Hi, my name is Kristen Howell, and today I will be presenting on the future of pharmacy. The following learning objectives will be what my goals will be for you to understand from today's information. I would like you to be able to understand how pharmacists can play roles in patient-centered care. I would like you to be able to identify future opportunities for pharmacy education and workforce. I'd like you to be able to describe pharmacy leadership roles for the future. I'd like you to be able to discuss evidence-based pharmacy practice. I'd like you to be able to understand the role of the pharmacist in the healthcare marketplace. And I'd like you to be able to identify where pharmacists can impact healthcare reform. First, I will be talking about how the future of pharmacy is related to patient-centered care. Before we talk about how a pharmacist fits into patient-centered care, we should discuss what patient-centered care is. This term has been around for more than 30 years and is to have the focus in healthcare be on the patient and their health outcomes. This can include multiple concepts to provide this focused patient care. Now let's look at this patient-centered care image. As we can see in this image, we view the patient in the center. We then look at the different circles which all relate to patient-centered care. Mission and values align with patient goals. Care that is collaborative, coordinated, and accessible. Physical comfort and emotional well-being are top priorities. Patient and family viewpoints respected and valued. Patient and family always included in decisions and decision-making. Family is welcomed in the care setting. And full transparency and fast delivery of information. So, keeping this patient-centered care model in mind, let's talk about continuity of care. Pharmacists can and will play a vital role in continuity of care. In different settings, such as specialty and ambulatory care pharmacy practice is advancing and is continuing to expand. Because of this, pharmacists are taking on greater responsibility, including managing patient panels. In other settings, such as acute care settings, pharmacists are needing to document discharge summaries to share with community and our ambulatory care pharmacists. Many pharmacy departments may be organized currently in silos of care or by the setting that they are providing care. However, they may need to restructure to be able to collaborate with pharmacists and other healthcare providers in other settings to be able to provide a need in patient care. An example of this is an infectious disease pharmacist who is practicing antimicrobial stewardship. ID pharmacists in these settings may practice in both an acute care setting or inpatient setting, but often these patients in these settings are transitioning out into ambulatory care settings. In this context, the pharmacist may be sharing the responsibility for care in both of these inpatient and ambulatory care settings, and they may need to help continue a patient's care from one setting to the next. They may need to help coordinate care with other healthcare workers, as well as for the patient to receive the care that they may need, including their medication management. Also, they need the support and infrastructure from their pharmacy department to be able to connect and provide the care from one setting to the next for the patient. Another thing that relates to patient-centered care is patient cost sharing. At this point in time, medication prices continue to rise. Higher medication prices lead to patients not receiving the therapies that they need. There are patient assistance programs out there, and the idea is that more may continue to arise with these elevated costs with medications for patients. However, the pharmacist can play a key role in this varying type of setting. For example, in the retail pharmacy setting, a patient may not be able to afford a brand name medication, and the pharmacist may be able to help coordinate with the patient how to get the medication for a lower price with the help of a patient assistance program. In another setting, A pharmacist might be working in an ambulatory care clinic, and they might help choose a medication for a patient based on the patient's insurance formulary to try to help ensure that the medication cost is covered for them. Patient-centered care also relates to retail pharmacy clinics and patient relationships. Retail pharmacy-based clinics hopefully will continue to be of interest for patients, as these clinics may provide great benefit and healthcare access in different communities. An example of this is through pharmacy-administered vaccinations. What may continue to trend in retail pharmacy as well is an increase in over-the-counter medication use. This may happen with increased costs in health systems and more information available to patients on the internet. Pharmacists do and will continue to play vital roles in these settings to be able to provide medical knowledge and guidance for what over-the-counter medications to choose and education about those medications. Although pharmacy and healthcare is ever-changing, at this time patient-centered care continues to be a focus in healthcare, and pharmacists play vital roles for patients. Next, let's talk about pharmacy education and workforce. In the pharmacy workforce, there may be more job opportunities for pharmacists with expertise in sterile compounding. As a reminder for those who do not know, sterile compounding is the preparation of medications in a sterile setting. An example of this is an intravenous or IV medication that is prepared for chemotherapy in a sterile setting. Beyond pharmacy school, additional certifications and trainings may be obtained by pharmacists to practice in these settings to have more expertise in this area. An example of a certification that a pharmacist may get is through the Board of Pharmacy Specialists. The future of pharmacy also includes the future of pharmacy technicians. It is advocated that pharmacy technicians have and/or receive higher levels of education. Currently in the United States, there is no uniform education and training requirements for pharmacy technicians. Also, although there are pharmacy technician certifications out there, not all states require that technicians have completed the certification to be working in these settings. It is important that pharmacy technicians continue to advance forward as pharmacists' roles become more advanced, because pharmacy technicians have many duties to support pharmacies and pharmacists and can really vary depending on the setting that they are working in. The next discussion point related to pharmacy education and workforce is non-traditional pharmacy residency programs. In fact, the demand for postgraduate training programs continues to increase year after year. In fact, at this point in time, the demand is much higher than the supply currently is. However, for those who do not choose through residency right after graduation, or are looking to complete residency training after they have been practicing for a while, it is unclear if non-traditional residency programs will grow or not with the traditional residency track. It is mentioned that it may be more appealing for non-traditional pharmacy residency programs to include other graduate studies into their programs to provide further career development, such as someone who's going to do a non-traditional pharmacy residency program that at the same time maybe they will be getting their master's of business administration or MBA at the same time. The next topic of discussion related to the future of pharmacy includes discussing pharmacy leadership. Pharmacy leadership must be able to show the value of pharmacy in whatever setting that leadership is working in: health system, retail, long-term care, etc. This is especially important as healthcare transitions to a value-based reimbursement model, because in this environment, pharmacists will be rewarded based on their abilities to reduce costs while ensuring medication therapy is appropriate. Leaders will play key roles to demonstrate the importance and value that pharmacy can bring to the table, which may be done by attending meetings with other leaders in healthcare systems to represent pharmacy. This includes leaders being able to obtain, measure, and interpret data regarding pharmacy practices. Besides leaders being able to show the value of pharmacy, they must be able to have entrepreneurial skills. They will need to continue to bring new strategies into their departments to not only offset costs, but continue to provide innovative pharmacy services. These ideas must be communicated to pharmacy staff to get buy-in sometimes. An example of this is a specialty pharmacy program that could be created from a health system pharmacy to try to create new revenue streams. Next, we will talk about the future of pharmacy and how it relates to evidence-based pharmacy practice. Artificial intelligence and other advanced technologies are definitely growing in the healthcare setting. Many technologies, such as artificial intelligence, actually plays quite a big role in a lot of different healthcare environments today. Some different pharmacy tasks may eventually transition to these different technologies rather than people completing them. However, more data actually needs to be collected to ensure that some of these tasks can still be completed appropriately and safely. Some other technologies out there may include some different mobile health apps. These can actually be helpful to help assess different patients' care outside of the provider's office and be able to get information right from patients' homes, right to the physician's office, without the patient maybe not even needing to go into the provider's office. Another technology that's emerging is printable medications. This isn't something that's readily available currently, but it may be something that's being considered for the future, especially in the drug development world. Depending what these printable medications look like, it potentially may be another way to try to help offset or lower medication prices. The next thing we'll talk about is evidence-based performance metrics. Some key performance metrics may be used to track different productivity, help with different quality, or even identify things that could be improved in pharmacy and in health systems. Health systems can identify and track different clinical, operations, and financial metrics related to pharmacy performance. However, sometimes there's just a lack of data to be able to identify that information, so there may be more of a focus on different structural and processing efficiencies rather than clinical outcomes. There is not a lot of evidence out there that may link current metrics with truly impactful patient outcomes at this point in time. However, a lot of money is being put into some different structural and process improvements to hope that patient outcomes will improve. An example of this might be some process improvement changes with goals of patient care outcomes. The next thing we'll talk about is the future, looking at the ethical use of genomic testing. So genomic testing continues to be advancing in patient care settings and in healthcare in general. A lot of different health systems actually are applying these into their everyday work right now by looking at things such as having molecular tumor boards, they'll have different pharmacogenomic services in clinics, and they'll have different medical genetics or services out there. However, it is noted that the interpretation of some of these different genomic testings can be difficult and challenging to determine. So, you typically need people who are especially trained in these settings to be able to understand how to interpret these results. As genomic testing continues to become more common into healthcare practice, health systems, including pharmacy services, will need to continue to work towards how to understand some of the ethical uses for the genomic testing. Next, we will talk about marijuana and medical cannabis. Many different state governments across the United States have legalized the use of marijuana. Medical cannabis as well has expanded for use for both acute and chronic conditions, with varying amounts of different evidence out there to support their use. Given that marijuana and medical cannabis do have some pharmacologic activity, there can be different side effects and medication interactions that exist out there as more and more of these products are being used in conjunction with patients already the medications that they may be taking. Currently, there's a lot of variability and unpredictability with how these different things are being used by patients, which can increase the confusion for both the patients who are using these products and even the healthcare workers who are managing it, including pharmacists. There still needs to be, or there likely will be, different changes in federal policies with how they're going to regulate marijuana and medical cannabis. There's some thought that there might be some regulations around it similar to what alcohol went through. The next thing we'll talk about is the healthcare marketplace. What will be important about the delivery of healthcare is that it needs to continue to be provided in different rural areas. It's vital that we are able to sustain this care in rural areas because there's a ton of people that live in these different settings. There are many different affiliations across the country that exist that can support rural areas, and some of these different affiliations are actually coming and collaborating together so they can provide care to patients. What else is being used to try to provide care to patients in these settings is the use of different telehealth technologies and home monitoring. So things like different phone calls or video visits or different smartwatches or different smart devices, they're helpful and will likely be the wave of the future for different delivery of care in different rural settings. Next, we will talk about healthcare reform. When talking about healthcare reform, we need to take into consideration some different state initiatives. Different states in the United States continue to work to try to make progress towards healthcare reform. The goal of having healthcare reform is the potential to expand healthcare access, increase transparency in prices, improve competition and patient choice, and ultimately, this is a great way to try to expand opportunities for pharmacists. In fact, in the United States right now, there's actually some collaborative practice agreements that exist out there. In these agreements, they may allow pharmacists to be able to provide more services than what they were able to in the past. Hopefully, these collaborative practice agreements, if they're in place right now, will continue to get less restrictive over time. Some great examples of collaborative practice agreements out there currently, some in Kentucky and California have expanded the scope of practices for pharmacists. So they actually have the authority of independent prescribing, as long as it's under this collaboration with their physicians. And they can actually help manage different disease states, such as different infections, tobacco cessation, and opioid use disorder. That concludes my presentation for today. Here are my resources. Thank you.